if you are ready, we are.
Thank you. So thank you everybody for sticking around. I'll do my best to respect the time limits. I'm going to talk to you about one of our latest works, co-authored with Mark Caruana and Nathaniel Dabono. And if there is any time, then I will segue into the other related research that I'm doing for potential collaboration. I will present my paper in three sections: a quick introduction and literature. Then I'll move into the materials and methods, and I'm showcasing this so that I can show you the kind of work I do, so that you can gauge if methodologically we can collaborate, and finally some findings and conclusions just out of interest. So the research is carried out in Malta, which I'm showing you in the map over there. It was published in Traumatology. And as you can see, Malta is right at the center of the world. So at least that's what it looks like from this map, but it is a very, very, very small country. By way of introduction, Malta is a country which at the beginning of the COVID outbreak and still to date is a very high economic growth country, typically scoring quite high levels of well-being, just marginally above the European average. There's a high level of social interaction in Malta, surprisingly and persistently low levels of cultural participation, except in traditional activities. The first COVID case in this context was registered on March 7th, of the year 2000, rapid escalation of measures followed by the government, and there was a very fast change in lifestyle. You can see on the screen to the right there that the first case was recorded, measures quickly escalated, closure of day centers for the elderly, religious functions and masses, no outdoor activities, passenger flights halted, closure of essential retail services, and culminating in people over 65 years of age being told to stay indoors. And we conducted our survey at the cusp of this, when all the measures sort of has escalated, we were ready to go. So by way of background on the kind of literature that I'm in, so there is a literature which is focused on measuring subjective well-being, that is measuring well-being by asking people how they feel, okay? How there is self-assessed happiness, there is self-assessed life satisfaction, anxiety, sense of purpose, and so forth. And in this literature, we are now, it's a burgeoning literature, and we know quite a lot about what determines this well-being. For example, we know that income, employment, and even voluntary work are positive determinants of subjective well-being. Income to a point, so beyond a certain level of income, it doesn't really help much for one's well-being. Health, mental health, and relatedly sport and good sleep are all very known determinants. Engagement in religious activities, environmental activities, and cultural activities are important determinants. Relationships, social interaction, and political trust, but also demographics like age. So we know there's a U-shape in well-being, gender, having children or not being able to have children, and personality. All these factors determine well-being. We also know some stuff about well-being in extraordinary times. For example, we know that people who were impacted by hurricanes and earthquakes experienced negative impacts in their well-being, but surprisingly also some positive impacts from camaraderie, getting together, volunteering, and so forth. We know that the Great Depression had a very strong impact on the well-being equation measured in this kind of approach. And we know that quarantine had a very strong and negative impact during SARS. So with this said, our method involved a questionnaire, just giving you a flavor of the kind of questions we asked. So the subjective well-being question, financial situation, activities in the last 7 days. But in order to find out what had happened with COVID, we also asked them to recall, and of course there is some hindsight bias here. We discussed this in the paper about life 3 weeks ago before the pandemic had hit Malta. We then measure exposure to COVID and worry about exposure. We look at any effects like cancelled events, having to quarantine, being swabbed, being infected, losing a job, even losing money, losing a family member or a friend. And we control for all the other factors that could determine well-being, including personality. We managed to collect in a very short while, almost 2,000 responses. We gauged how representative this was. We did this on social media. We gauged how representative this was by comparing it to the whole population, finding that our sample is somewhat younger, more educated, and more likely to be female. This is typical of questionnaire collection rates. We then stipulated a model. Well-being is a function of exposure to COVID and all those other things I spoke about. And we stipulated a number of hypotheses. For example, that well-being would have declined during COVID, that it's linked to exposure to COVID infection, for example, and that the whole well-being equation changed. So first finding is massive lifestyle change during this period. No surprises. It hardly takes a scientist to find this out. But if you look at where those two arrows are, for example, you will see that 87% of our respondents told us that their social activities had declined, and 43% of our respondents told us that they had increased their level of working from home. This is just to give you a flavor of the type of lifestyle change there was. In other areas, for example, spiritual activity didn't change much. 68% told us that it remained the same. So the first finding is massive lifestyle change. Testing our hypothesis as to whether well-being declined during COVID, if you look at the histogram of self-reported happiness before COVID and life satisfaction before COVID, you will see a typical right skew, okay? You will see that most people report 8, and then fewer report 7 or 9 out of 10, okay? And very few people report 0, 1, or 2. But if you look at what happened during COVID, this was the happiness reported by people and their life satisfaction. And you will see far more people reporting 1, 2, or 3 on the Cantrell ladder. Indeed, it was interesting. We had spoken about this. There was a lot of emphasis on the flattening of the COVID curve. You might remember this. And we said in our outreach that we were observing a flattening of the happiness curves in Malta. So yes, we did observe a decline in well-being in COVID times. To test whether exposure was responsible, this is not for you to go through in any detail, but just to show you the kind of research that I'm involved in. We ran regressions, we controlled for exposure and worry. We found that with the inclusion of these variables, our regression forecast a lot better. And we also found that these variables were negatively and significantly correlated with happiness. That means that exposure and worry about COVID-19 significantly suppressed well-being. All the other variables were doing the kind of thing we expected them to do in such models. So we concluded that we found some evidence for high exposure to be associated with low well-being. Thirdly, we tested whether the well-being equation itself had varied during COVID times. We found smaller and larger coefficients in comparison to pre-COVID times. For example, we found that engagement in artistic and sport activity and volunteering, being able to sleep and doing paid work at home were positively forecasting well-being during COVID. And we found that previous coefficients were manifesting different signs during COVID. So in short, and because I don't have much time, we did find that there was a change in the well-being equation during COVID times. We had, for technical people here, effectively a kind of panel of data because we had pre-COVID, post-COVID. And so we re-estimated the models trying to find out whether there were causal effects. I won't get into this. But in conclusion, what we found from this study was, first of all, a dip in happiness and life satisfaction during COVID-19. Secondly, we found that worry and exposure to COVID-19 predicts lower well-being. Thirdly, we found that being ill, being poor, having low education and being elderly was associated with lower well-being during COVID-19, while working from home, engaging in sport, sleeping well, and engaging in arts and cultural activities, which you may recall a lot of people did around the world. You know, people were doing all sorts of crafting and cooking and so forth, was associated with higher well-being during COVID-19. Caveats of my research and our method in general: we're relying on survey data, self-reporting, and indeed recall. The sampling frame may mean that there is some participation bias, so people who responded were interested in well-being and in COVID. We have excluded the hardest hit individuals who are so poor, so badly off that they can't even entertain the prospect of filling in a questionnaire. And we are careful not to attribute causality when it's merely correlational. Our recommendations, which we sent very quickly to the health authorities, were that while respecting social distancing, there was a lot of emphasis on social distancing at the time, we should be encouraging citizens to continue to exercise and to engage in artistic activities. And we said, you know, we can use television stations for this. There were a lot of public announcements. We also said that we should encourage efforts to do voluntary work and to do paid work from home, and that we needed to pay attention to people aged over 60, particularly, and those who are struggling financially. The study was quite well reported in the media. So in one headline, they reported that the study found people's happiness was down by 1/3. And we also observed that our predictions, so to speak, panned out. Requests for mental health support jumped 500% since COVID. I didn't tell you my fields of interest before my talk because I wanted you to get a flavor of what I do before I do this. So I'll very briefly conclude by introducing myself. I'm a behavioral economist and an environmental economist. So this is what I do: behavioral changes, environmental interaction with the economy. My special fields of interest are well-being, environment, politics, and culture. I'm very, very active in outreach. I've won awards for STEM outreach, for creativity, for publications, book awards, and for broadcasting. I'm very keen on having impact, and so I design a lot of my research in collaboration with the public sector. So I enter into collaborative agreements where we agree on the research to be done, which will service their policy making. I come from a 15-year career in the public service before I came to academia. I work on a number of committees where we may also find collaboration possibilities. I'm on the Research Ethics Committee, I'm on the Sustainability Committee of the University, I'm on the Chamber of Scientists of Malta, and in the Society for the Advancement of Behavioral Economics. A flavor of my ongoing projects, I will conclude very shortly. I'm right now working with two co-editors in order to publish a book on well-being, and we're looking for papers that provide evidence of impact of well-being interventions. I'm also in a collaboration with the Malta Wellbeing Foundation, where we're working on what is called the Wellbeing Index Project, trying to design reliable metrics for the measurement of well-being in Malta in order to go beyond GDP in measuring the success of policy in Malta. I'm in a Horizon 2020 project, which looks at ecosystems-based fisheries. And here we're also looking at the well-being impacts of interaction with the marine environment. This may be interesting for a couple of you who have spoken earlier. I'm in a collaboration agreement with the Environmental Resources Authority of the University of Malta, where we're focusing on reuse behaviors in Malta. I'm concluding some work on circular practices by enterprises across Europe and in Malta. I'm in a collaboration with the Arts Council, where we're looking at practitioners, their well-being, their quality of life, their earnings, and what drives them to become professionals in the arts. And I'm concluding a project on how the Capital of Culture initiative impacts European identity. I made a selection of publications. I'm naturally not going to go through them, but if there's any interest from any of you, I divided them by field. So I will send this to you if you're interested. It's on my open access repository. That's my contact details. I've tried to be brief. I hope I haven't gone too fast, and I thank you for sticking around.
Thank you very